Hello, everyone. Let's go ahead and get started. I'm going to be admitting a few people. So as I speak, I'll just continue to admit some of y'all in. Hello. So thank you for joining us on our panel discussion about normalizing home visiting services in Kansas. I will introduce our speakers, but a couple of reminders first. We are recording this session, and it will be available approximately an hour after the presentation is over. We want to hear from you in the chat, so please use the chat on the Whova app. Please do not use the Zoom app. We have disabled that chat. Please keep yourselves muted. And with that, I am going to go ahead and hand it off to our presenters. I'll have them each introduce themselves, and then we'll get started into our questions. First, Cathy, then Tiffany, then Starla.
Hi, I'm Cathy Shald. I'm the coordinator for the My Family Central Intake Program in Montgomery and Wilson counties.
I'm Tiffany Green, and I also coordinate My Family, except I'm in Cherokee County.
I'm Starla Bieberle with Kansas Children's Service League, Healthy Families in Great Bend, Kansas, smack dab in the center of Kansas. I'm a home visiting specialist.
Awesome, thank you. And then Becky, Kaya, and Alex.
Hi, everyone. My name is Becky Whitney, and I'm a community navigator with the Connections program within Project Eagle. We serve families that live in Wyandotte County, located here in Kansas City, Kansas.
Hi, everyone. My name is Alex Phillips, and I'm the Community Engagement Coordinator here at Project Eagle.
Hi, everyone. I'm Kaya Price, and I am a Community Navigator with Project Eagle.
All right, thank you all. So we're going to go ahead and get started. I have a few questions, and as y'all think of questions yourselves, please drop them in the chat. We can have a really fun discussion. Later in the group, we will do breakout sessions where we'll get to have a more directed conversation. Okay, so our first question to the panelists, and it's open to anyone who'd like to answer. How is home visiting presented to families who may be interested in starting services?
Hi, this is Becky. I can answer this question. So one thing that we do prior to even going to visit the family is think about which home visiting programs the family is eligible for. So each program has different eligibility requirements. So we look at maybe the child's age, the family's income, maybe what school district they're located in. So we look to see which program they're eligible for. Another piece of what we do is look to see which programs have capacity to take new referrals and new families. So we have a little bit of information prior to even going out to do our intake visit with families. So during the visit, we talk about their different options for programs that they're eligible for. We talk about the benefits of the home visiting program. I really try to explain the differences in each program. So maybe it's the frequency. I'll find out from the family what they're interested in, what their schedule's like, what's the best fit for them. So we work together with the family in partnership to determine which is the best fit for the home visiting program for that family. It's important, I think, to think about really the why they're interested. So, that helps guide our conversation as well. So they're wanting to learn parenting skills. They're wanting to learn more about child development. Maybe they're looking for socializations, wanting that extra support with community resources. Maybe they've had a previous experience in a particular home visiting program. So we really try to use all those pieces to guide that conversation and talk with the family about what's the best fit for them.
And we're just a little bit different in Southeast Kansas. We don't majority of the time meet the family at home for the initial thing. We're meeting them at WIC, or that's like 80% where we meet our family. So we're just a little bit different, but then we go ahead and ask the same questions as connections do.
And here at Kansas Children's Service League Healthy Families, we have our referrals come from WIC, hospitals, friends, families, community members. We enroll, our services are a free volunteer program, and we enroll prenatal preferably up to 3 months. And then they can be in the program up until the child goes to preschool, or up until 5 years old. And we meet in the home weekly, and then they progress to bi-weekly and monthly. And we started in 2018 and in Great Bend, and we're almost full, and we get a lot of friends referrals, self referrals. So but we just share parenting, give support, child development. We do all kinds of things based on what the parent needs as well.
Awesome. Thank you so much. So our next question is, what does your family engagement process look like? How do you get families engaged, and how do you follow up with them after referring to a home visiting program or service?
So for connections, it really starts out in the community. So I'm the community engagement coordinator. So really it's just finding those families who may be interested in having that connections visit, meeting them at community events. Also a really big piece of it is having those community partners. So WIC, we have a great partnership with Providence Medical Center. So really just finding every avenue possible to receive those referrals, engage those families, and encourage them to have a connections visit with one of our community navigators. And then after they complete that connections visit, they do follow up with the parent and the family to make sure that those resources that they were given worked out. If they were interested in a home visiting program, have they heard from that home visiting program yet? And really just to make sure that everything worked out, and if they need any additional resources and information at that time.
And we also get referrals from community activities, but also we use the IRIS system where referrals will come through pediatricians, DCF, and different things like that. And then once again, we do a 2-week follow-up to make sure the home visiting has contacted them. And then we do a 30 days to see how it's going. And then the other contact is just if we see them at WIC or through other events. So we enroll them, make sure they're enrolled, and then it's a handoff. We're done.
Our program is a little bit different. When we get the referral from WIC or community members, they're assigned a support specialist that fits best with that, like those families' needs. And then we go out and meet with them, and we explain that's a volunteer program, and they're enrolled from the get-go, and we meet with them weekly, and we provide resources and things that they need. And we had a community baby shower in our community, and we got a lot of referrals from there. It was awesome event. And when they're referred to us, we are the home visit. We have other home visiting services in the community, but once they're referred to our agent, our program, they choose if they want to enroll or not. So it's so we have a real good turnout. So
Great, thank you. Okay, so what happens when a family does not want services? Could you please share how you motivate them to enroll, how you keep them engaged, or how you engage them?
Sometimes it takes a long time to get a family engaged. So there's families that I've known for years that I don't have engaged yet. And there's families that I've known for years and finally they feel comfortable enough to try a program. So just being consistent and providing them with other resources so that they know that you're a safe person and you provide safe resources for them, I think is really important. Sometimes approaching them in Southeast Kansas, we have a diaper program where they can earn free diapers by engaging in activities. So approaching them with that and approaching them with signing up for the Dolly Parton Imagination Library or things that are going to benefit their family, and then seeing them time and time again at events and at WIC clinics, building that rapport. Eventually, the goal would always be to get them connected, and a lot of times it works.
Well, with connections, we meet with the family and we explain the program, what we do, because we have an early head start program here at Project Eagle, and we explain what we do, the services we provide, how we can provide family support, and the things that our home visitors do to provide the family with support. And, and then if there's some barriers, we try to figure out what barriers they're having. So some families, they work, so they may not get off until 5:30. Well, that's fine because our home visitors can come out at 6 o'clock to 7 to work with your family. So just trying to figure out what barriers they have. And then that helps once they know that we can offer these late appointments and things like that. Then they're more likely to engage. But then there are some families who just are not interested in engaging. And, then I'll just be like, well, if you are ready, when you're ready, you can please just give us a call. And some do call later once they get stable, if it's housing or they're trying to figure out their work schedule. They'll call us back when they are able to. So just explaining the program and what we can offer here at Project Eagle. And then we also explain the other programs too that we refer out to.
We and when they refer to our program, we set up a time to go and do an enrollment visit, and we go out and we explain our program, that we're a volunteer program. We're strengths-based. We focus on the parent and the family's strengths, and we explain to them that we're not there to tell them how to raise their children. We use the GGK curriculum, which is awesome. We do a lot of visuals with curriculum. It's, a lot of people don't like handouts and to read material and use big words. And it's our curriculum is done in a way that it is really, families are able to connect, and they feel like they get empowered. We have a lot of parents that start out that have said people are trying to tell them what they do, and they're telling them what they're doing wrong. And with child welfare services, we get a lot of referrals from them, and they think that they have to be in the program or they're going to get their children taken away. But we reassure them that that's not the case, that we are here as a cheerleader just for support. And then we build that relationship where they learn to trust us and know that we just want the best for them. And I used to work in child welfare, and just seeing the children and the families getting ripped apart and how that affects families, it just was it's heartbreaking. And I couldn't. So when this opportunity came up to work for Kansas Children's Service League and Healthy Families, I jumped on it, and we're focused on the prevention. And it is just rewarding to see how mothers that don't have any self-esteem or any resources or any support, how they can just build and they just see how they connect with their kids and they're rewarded too. It's just amazing. I just love it. So
We did have a question come in the chat. How many services like this offer late appointments? Is it a day designated for scheduling of later appointments, or are they just outside of regular hours?
We tell our families that we work around their schedule. So we don't tell them, okay, your appointment's at 5 o'clock on Wednesday afternoon. We don't do that. I've met with some families at 7 o'clock in the morning because that's the only time they can meet. I've met with families at 6 o'clock on a Friday because that's the only time they can meet. We try to work what's best for the worker and the families, but it's based on their schedule and their needs. Because if you got a family that's working, that's important. They don't need to miss their job or to meet with us. It's not about us. It's about the family and what they need. So we try to work the best around our family schedules as possible. So
I think that's true with all the home visiting services, early Head Start and Parent as Teachers and Healthy Family. They work with the family for what's best for them.
Okay, so our next, we have another chat question. Does this involve lots of overtime, comp time hours? How does that personnel part of the piece of this go?
So with us, with Project Eagle, we're only able to work 40 hours a week, and we do not get overtime. So it has to be within our 40 hours.
our agency is very, very accommodating, and we flex our time. So if I have to meet somebody at 7 o'clock in the morning, then I would leave early in the afternoon or take off, at the end of we just work that out with our supervisor and just let her know what our schedule is and what we need to do. And visits have to get rescheduled. I mean, that's sometimes that if a visit is scheduled and the family's sick or whatever, then you have to reschedule. And then if they can't meet that week, then we just try to make sure we meet the next week, or and do the best that we can. So yeah, we are only able to get 40 hours as well, but our agencies are very, very accommodating and work with us, and don't expect us to get all our visits in 40 hours if it's not possible. It's a good balance.
Okay, so our next question, we've kind of already touched on this a little bit, but can we talk about some barriers in each of your communities? And how have you overcome some of these barriers when engaging families?
I'll speak on behalf of Connections in Wyandotte County. So some barriers that we're noticing that families are facing is homelessness. A lot of them are facing eviction, disconnects of utilities, then struggling with trying to find agencies that can help support them with financial assistance for those things. We're noticing more families are living with other family members, so there'll be multiple families living in the same household. So when it comes to home visiting, there might be some privacy concerns and barriers with being able to conduct the visit with families in their home. And I think a lot of families right now are really focusing on just their daily needs and honestly like survival. The cost of living has gotten so expensive, and food, and there's a lot of resources we can connect families to, but families are, I think, having to work more, trying to pick up more hours, and then there's a need for finding childcare for their children. So when it comes to doing home visiting, and families are really in that survival mode, and trying to just get their basic needs met for their family, we've touched on this a little bit, but it's very important that we're being flexible as a program and as home visitors to meet them where they're at. Meet them when they're available to visit, depending on their work schedules. Maybe if they live in a home with multiple people, we can meet them in the community, at a public place, somewhere that's close to their home. If they are willing and they have transportation and are able, we do have a space here at our building. They could come and we can visit with them here. We've even done visits, you know, in the front yard, on their porches. Just a few weeks ago, I was standing in the drizzling rain, with a young mom, and you know, she has a lot of people in her household, and we just stood there for an hour and talked, and it was a wonderful, successful visit. And she's coming to a home visiting program. So I think it's just meeting them where they're at, listening, actively listening, and just, you know, being there and supporting them with whatever barriers, problem solving, working together as a partnership, and just, you know, being able to be reachable and follow through with what you're saying that you can help the family with.
Kind of piggyback off of that, because we see a lot of those same issues, even though we're rural and you're in an urban area, we're seeing a lot of the same things. So just making sure that we have as many resources and we know about as many resources as possible, so families know that we're not just trying to get them connected to a home visiting program if they don't have food for dinner. So we want what's best for the family. So connecting them with as many other resources as possible just to meet those needs, because there's so many needs right now. So connecting them to anything we can connect them to. And maybe home visiting isn't gonna be on the table for 6 months, and that's okay. So let's get them connected to all these other things, and then we'll come back to it, because that's always our goal, to get them connected, but just kind of being available for what the family needs.
Our biggest barrier in our community is child welfare, like trusting people, because they've had people come in their home and tell them what they're doing wrong, and that just, you know, they're fearful that if they sign up for a home visiting program and they let people in their home, they're fearful that we're going to come in and judge and take their kids, because that's, you know, they've been in foster care themselves as a child growing up. And so it's hard for them to trust. So we reassure them that that's not our goal. Our goal is to keep families together and do what's best for the family. We have family nights where we get moms connected to other moms, and we have a really big turnout for family night. We have a care portal that in our community that we can reach out to for needs, if people need help with their gas bill or car repairs or furniture, or we have Birthright. We use Birthright. It's a wonderful resource for baby needs. We have our community the community is working together to connect everybody to resources in our community, and it's wonderful. But drug and alcohol use is another one. They're worried if we come in and they're smoking marijuana, and we work on that with the family and let them know, we try to use those resources for mental health issues and all that kind of stuff. But we reassure them that we are not there to take their kids. And that's the biggest barrier in our community right now, I feel.
Okay, and this next one's going to be a little bit happier. So can y'all share some success stories in family engagement? Just any success stories that you have. I'm sure each of you have plenty of really great stories to tell.
I can go first. So I was in Project Eagle myself with my daughter back in 2008. And I was in the home base and our center base too. And Becky was actually my family advocate back then when I moved to home center base. I found this to be very helpful and useful for me, because my child did have a behavior problem. And I just remember that they were very supportive. They would come to the meetings with me. and they would help support me, find resources in the community for me, provide transportation and things like that. So that was very successful for me because I didn't know anything about home visiting. Yes, I had a bachelor's degree from college in psychology, but I didn't know about home visiting until it was introduced to me. And then I learned that, my child was learning and that it was so important for her to be learning. And even though we were learning at home, it helped me to do educational activities with her. And now my child is in high school and she's doing great, excelling academically. And I also went off to school and received my master's in social work. So it was very successful for me.
We started our program in 2018, and we just graduated 5 families that have been with the program for at least 3 years or more. We just celebrated one mom. It wasn't my family, but we celebrated one family that when she came to enrolled in our program, she was in drug and alcohol treatment and living in an Oxford home. And she, with the support of her home visitor, Mary Dumler, I'm going to give her a shout out. She's amazing. She was able to get her own home, her own vehicle. She went to school. She got her CNA, CMA. She's going to nursing school. And her daughter she's got a great personality. And it's just amazing to see the success, how you give them the resources and they just go with it. And it's just amazing to see the families. The graduating 5 this year was bittersweet. It's hard. It's when you see them have to leave the program because they're doing so well.
Well, I just think it's fun when we see the moms again at WIC, and if they've had a new child, they want to make sure we meet the new child. They just, are thankful for the help we gave them. And even though we don't see them on an everyday basis, they still want to make sure we know how they're doing. And that's always fun.
I was going to say, because Cathy and I we're not home visitors, we are on the recruiting side. So kind of from a different aspect, just kind of a success with our partnership with local agencies has been super successful throughout centralized intake. So the relationships that we have with local health departments and our DCF social workers and mental health is just something to celebrate, because when we can come together and work together, we can provide more resources and help more families. So that's been a huge success with this program.
Okay, so before we move on to our breakout rooms, does anyone have any questions? You can come off of mute. You could also put it in the chat if we haven't answered it already. And we'll just take a few minutes just to ask any of those remaining questions, and then we will split off into our breakout sessions. So there is one that was placed in the chat. Are you all having declining enrollment? Is that one that we've already asked? Okay.
We're not in our counties. All our home visiting are full and on wait lists and everything. So we're seeing an increase in our enrollment.
We are keeping steady. Like, we graduated 5 and we're our caseloads are we have 5 home visitors, and the average caseload is like 12 families. And our limit is like 15 for each caseload. But we're seeing a lot of referrals from people that are in our program that are referring to their friends, and then they're enrolling, and just by word of mouth. So that's amazing. But we have not seen any drop off in our enrollments.
That's really, really good to hear. Are all of your programs income-based?
Project Eagle is income-based, but the other programs that we refer out to are not. So like Healthy Families is not income-based, but Project Eagle is.
For the Head Start programs, but the
Yes.
Connections program is universal. So we will see anyone who has a child under the age of 5 or who's expecting a baby.
Our program started out as income-based. Referrals had to meet the, the poverty level or whatever. But we just recently started Families First program in KCSL. And we get those referrals from DCF. So they have different requirements. So they don't have to be under 3 months of age. They don't have to be the income based or whatever, but some of the requirements are income based, but not. It's kind of different now.
For my family, we connect to both income-based programs and non-income-based programs. So we have a variety, so we can meet the needs of anyone that has a kiddo under age 5 or who's expecting.
Okay, and then last question before we go into our breakouts. Which evidence-based home visiting curriculum or programs do you all refer to?
With Connections, we refer to Early Head Start. We also refer to the Healthy Families programs. Here in Wyandotte County, we have 2 different agencies that offer Healthy Families, one being KCSL, Kansas Children's Service League, and then also through our local health department. We also refer to the different Parents as Teachers programs. So there's several different school districts here in Wyandotte County. So we look to see which Parents as Teachers program they would fall into based off of school district boundaries. And then also too, we can refer to a program that's called TIES. It is through Children's Mercy Hospital. And it's for it's home visiting and support for parents who are seeking support from substance use.
My family refers to Greenbush Parents as Teachers, KCSL, Healthy Families America, and then CCAP Head Start. Those are our evidence-based programs that we refer to, but depending on our counties and what other programs we have available, we also refer to different preschools and programs depending on what the county has to offer.
And we refer to our evidence base through our mental health center. It's called Project Before, and it's a family case management. So they can help reach some goals for families also.
In our area, the curriculum that we used is Growing Great Kids curriculum. We have a week-long training on it, and it's strength-based. It's talks about parent-child interaction, bonding, like postpartum depression, setting goals, all, different kinds of things like that. And then we also use different curriculum that's recommended by the Healthy Families America. And we do have a lot of community resources as well that we refer families to as well.
Okay, so we are now going to break out into our 2 breakout rooms. So you'll choose which breakout room you're going into, either urban or rural. And it is open for everybody to chat and have a conversation with some guided questions. It looks like everyone's starting to join back in. Okay, well, I wanted to thank all of you that participated today, all of you for joining us for this panel. And then I also wanted to thank our panelists today for doing such a great job and speaking with us today. Just a reminder, tomorrow begins with our keynote at 12:30. So 12:30 in the Whova app, just like you did today. And yeah, that concludes day one of the conference, and we look forward to seeing you all tomorrow.